And President Biden's diagnosis has a lot of people asking questions about prostate cancer.
Yeah, and earlier today on KCRA3, we asked our viewers for some of their questions for a local urologist. And KCRA3's Curtis Ming is getting some facts for us.
Yeah, we spoke with the director of urology at Sutter Roseville, Dr. David Yee. Obviously can't talk specifics about President Biden's case, but he could answer questions about prostate cancer. And here's one on a lot of people's minds tonight. Who should get tested?
Between the ages of 55 to 70 have the greatest benefit of having annual screening. And so those are the patients that we typically focus on. However, if you have a family history of prostate cancer or are at higher risk, for example, African-American men, then we drop the PSA screening to people as early as age 45 and sometimes even age 40.
Well, he says those most at risk are people with 2 or more immediate family members who were diagnosed with prostate cancer. And that leads to our next question. What are the signs to look for?
Maybe it becomes more difficult to urinate. You're straining to void. Perhaps you're getting up more frequently at night. However, the tricky part about that is oftentimes there's something called benign prostatic hyperplasia, or BPH, which half of all men at age 60 have. And so sometimes it's hard to tease out whether these are BPH symptoms versus prostate cancer symptoms. Oftentimes it's difficult to tell. That's why the PSA blood test is helpful, and the digital rectal exam.
So if you are diagnosed, we asked the doctor, how is prostate cancer treated?
The first mode of treatment for prostate cancers that spread is to suppress their testosterone, because we know that testosterone is the food for prostate cancer to grow. And if we restrict its food, the prostate cancer will shrink. And so that's usually the mainstay of treatment initially for those that are diagnosed with metastatic prostate cancer.
So can you survive prostate cancer? If caught early, Dr. Yee says yes, nearly 100% of the time. But once it spreads, that drops to 37%. Although modern drugs are giving patients a quality of life for up to 10 years. Back to you.
Yeah, simply said, get checked. That's for sure. Thanks, Curtis.